Um, okay, get started. I'd like to welcome everybody to the International Society of Fire Service Instructors webinar series. I want to remind everybody that the session is being recorded, so please keep your microphone muted and your screen unshared so we give an opportunity for the presenter to speak. If you have any questions, please click on the chat window to your right hand of your screen. Click on that, and you can enter your question in the message box. There will be around 30 minutes into this, and then again at the end to answer any questions. Myself, my name is James Lannon. I'm the Assistant Chief of the Western Taney County Fire Protection District outside of Branson, Missouri. I'm also the Print Curriculum Development Chair for the International Fire Service Instructors. Today we are going to be discussing a very taboo topic, I guess. It's one of those topics been swept under the rug for a lot of years. It's been brought by several people in the last couple of years. I'm joined today by Jeff from Firefighter Behavioral Health Alliance, Dr. Beth Murphy, who is a clinical psychologist, retired firefighter, and also Shannon McQuaid, who comes from a long line of firefighter families that deals with the physical health aspect of fire service. So I'd like to give our presenters an opportunity to introduce themselves, kind of their background, and we'll move forward from there. Jeff, we'll start with you.
Well, thank you, Chief. I'm honored to be here today. I am a retired fire captain from outside of Chicago, one of the suburbs, 26 years on the job, 6 as a volunteer, 20 career. I went back and got my master's degree, became a licensed counselor, and I'm founder of Firefighter Behavioral Health Alliance. We are the only organization in the United States that tracks and validates firefighter and EMS suicides. And, like my friend Beth over there, we travel across the United States and Canada presenting workshops. Last year, about 127,000 air miles. So we keep very busy. We have 7 different workshops, and we know that this is an issue and it needs to be attacked in a most urgent fashion. So, like I said, I'm honored to be here, and I know of Shannon, and I know that physical fitness plays a major role in behavioral health fitness as well. So.
And so
Dr. Beth Murphy,
I'm Dr. Beth Murphy. I am a clinical psychologist and retired firefighter. I am out of Bellevue, Washington. And that's also where I was a firefighter. And once I got into the fire service, I got interested in psychology. So I actually was going to school while I was working and ended up going through and getting my doctorate in psychology. My research was on women firefighters' experience of stress on the job. And then in my current clinical practice, I see a lot of firefighters and police officers, and I specialize in trauma and traumatic stress, along with like chronic pain, chronic illness, and then kind of see other people too. So, from just like transitional changes to some pretty significant PTSD type issues. And I actually, when I speak, I reference Jeff a lot for his statistics because he's like the only person that is collecting data on firefighter suicide. So it's an invaluable source of information.
Shannon, that brings us back to you.
Okay, great. I'm Shannon McQuaid. Like the chief said, I come from a family of firefighters. My father, sister, uncle, and brother-in-law are all firefighters in the San Francisco Bay Area. And from my family, I understood the physical and psychological toll of firefighting. So about 3 years ago, I piloted a program in the San Jose Fire Department in San Jose, California. And since then, Fireflex Yoga has grown to 7 Bay Area fire departments, and we just started in 1 police department here in California. And I've noticed when I first started with Fireflex Yoga, almost all the discussions were looking at how yoga could prevent injuries related to strains and sprains. But I would say in the last 2 weeks, I've had more calls than ever from fire chiefs who are curious to see how yoga can help with mental health and behavioral health. So there's been a significant shift in Bay Area fire departments in terms of their interest in Fireflex Yoga in helping firefighters at their departments. And one of the first persons I reached out to when I started Fireflex Yoga was Jeff Dills, because his organization is so unique. And again, I have this opportunity to see the shadow side of firefighting, again, growing up in a fire family. So thank you for having me here this morning, and I'm looking forward to participating.
Get started today by asking, I don't know, the most obvious, how did we get here? How did we get to a point where these statistics are becoming such a great influence on the way that we're doing things now? Why didn't we know about this before? And how did it kind of get over, I guess? Jeff or Beth, you guys want to chime in on that?
Well, I mean, I can say from my perspective, because I spoke at FDIC for the first time probably 7 years ago, and they were just really starting research, and I think in 2011 they had put out a white paper about the mental health issues and how it's something that needs to be addressed. But there was a hesitancy in how to get it out there because their concern was that it would put people off, and that they weren't going to listen to it, they weren't going to talk about it, and so there was a lot of discussion about how do we get mental health to be part of the fire service. How do we address mental health? How do we help that aspect? And from my perspective, I'm like, it's simple. It's like, just start talking about it. It's something that nobody really has talked about, and it's progressed. So from the time that that white paper came out and I started presenting, there have been more and more and more presenters, and so more people are talking about it. And I think that we've been slow to come into it, but we're putting a lot of effort into talking and building, and Jeff's information has been extremely important in really setting the tone of urgency.
Well, and in 2009, when I founded Counseling Services for Firefighters, I was doing workshops on training counselors that if you want to work with us, you need to understand us. We're a little different. And I just, I was in school for my master's. When in 2010, I started receiving emails and phone calls from all over the world saying, do you do anything about firefighter suicides? And it's like, wow, no one ever talked about this. And I'm in this service, and I didn't know we had a problem. And you start digging and finding through. And then our first 4 workshops in 2011 were for the Philadelphia Fire Department. And I walked in and said, hey, we'll be talking about suicide prevention and awareness. And you thought I had leprosy. We just don't talk about those things. And now where we sit here today in 2017, it's unbelievable. Of course, cancer, PTSD, and now suicide prevention and awareness. And, I echo what Beth said, is that we need to talk about it. So when we founded FBHA, we had three mantras, and that was, challenge with compassion, be direct. When you see something in one of your brothers or sisters, ask them. And then our third one is doing an internal size up, meaning we have to look within ourselves to see what's going on in our lives, and the best way to do that is by listening to others who say, hey, you seem to have changed, Jeff, over the years, and I make this guarantee, and I think Beth can agree with me, is that you've been in this business, you've changed, and there's no doubt about it, and how can we not, with all the things that we see and do and what's expected of us on a daily basis, and we take that home, and it affects our families, so it becomes an issue, but yet more and more we're talking about this. And one of the conferences I spoke at, one of the national ones, they said for the first time last year they had more requests to speak on behavioral health than fire operations. And that's saying something. So if we can just keep on going with what we're doing, but we have to take it at a slow pace too. We don't want to rush into this, and it has to take time to develop. But I'd like to see in 10, 15 years, maybe every fire and EMS organization have some type of behavioral health program, and resources, qualified resources to help handle these issues. And it starts, like I said, in the fire academies, the officer classes, and I'm in agreement with Shannon, is that you have to have that physical fitness component as well.
Mm-hmm.
Since we've kind of discovered, I'm hoping this is better on my audio now.
Much better. Yes.
Mm-hmm.
Since we've kind of discovered that there is a link between the physical fitness and the mental health aspect of it, Shannon, we still know that when it comes to fitness and the things that are hurting our firefighters, we all know heart disease is still the number one as a line of duty deaths go. What can we do to kind of help that physical aspect a little bit before we jump into the mental health thing?
Well, I really can only speak to yoga practice. I mean, I'm not trained to discuss other types of exercise programs for firefighters, although there's a ton of great research on there correlating, just daily exercise to better physical health. But yoga, because it is a mind and body program, it's actually designed to, first of all, cultivate awareness, which is really important in everybody's daily life, just understanding, what you're eating, how much you're sleeping, what your attitude is like, and yoga practice is designed to get people to experience that kind of awareness. And that will translate to, taking better care of yourself, eating better. But what we know specifically, so yoga, just to back up a tiny bit, yoga is really a combination of three things. It's the physical postures, it's the deep breathing practice, and it's also the mindful meditation and or concentration. So there's been a lot of research that's been done on deep diaphragmatic breathing and having a positive impact on something called heart rate variability, which is correlated to longevity and overall health, and also cardiac vagal tone. So so just the deep breathing by itself can potentially have a very positive impact on heart health for firefighters and first responders in general.
Chief, let me jump in real quick. Well, Chief, you had mentioned a couple times the stats, and let me just throw those out there right now as of this morning, because unfortunately we validated an EMS one this morning. 970 of our brothers and sisters in the fire and EMS we have validated. And that means I've spoken to close to 900 fire and EMS chiefs and family members and heard the stories. In 2015, we had validated 135, that being 101 fire and 34 EMS. Last year, 132 with 99 and 33. And this year, we're at 16 with 12 firefighters and 4 EMS. And I still have about 4 or 5 in 2017 to validate. So yes, the last couple of years, based on our validation, we have lost more just firefighters alone than line of duty deaths, and we only estimate about a 40% reporting to us. And it's because we really don't go out and solicit and advertise who we are, so everything is by word of mouth. So absolutely, this is an issue that we need to deal with.
Jeff,
you gave the statistics.
Yeah, good,
ahead.
James. No, I think you were going to do the same thing. Go ahead.
So Jeff, you gave statistics for the suicides that you've actually years. What were our numbers for last year? I'm curious to see what your number for last year alone was.
Last year, in 2016, it was 132 that we validated, 99 being firefighters and 33 EMS. So we're
short by in the fact that suicide is now encroaching on the deaths as the number one killer of firefighters.
Well, I mean, it's really tough to make those statements because until we get 100% reporting, but what we know for a fact, like in 2015, there was 86 line of duty deaths, and we validated 101. And 86 is 100%, and ours is at 40%. So, and same thing for last year. And that's where, like I said, we need to really attack the problem early on, especially in the fire academies.
You say 40% reporting because there's a lack of an outlet or a way to report, or is that because some people aren't sure if it's actually related? What causes only that 40%?
Well, it's a combination of, like I said, a lot of people don't know about FBHA. No matter where I speak, we did 47 workshops in the last 6 weeks, all across the United States, and so we were very, very busy. And I would say maybe 90% of those people, all that we saw, like we spoke at the Alabama fire chiefs, about 225, 230, and only about 7 or 8 knew of anything about FBHA. And afterwards they came up and said, our department lost 3 or 4, or this department lost a couple, and that's how we start getting some of those numbers when they report them to us through our webpage. So that 40% is only a lot because no one really knows about us, because we don't really go out and solicit. And it's very difficult. I mean, it's very personal, these issues. And there have been some that we have validated where the fire chief said, we absolutely believe that it could have been, but the medical examiner ruled it accidental. And a lot of those we see on the overdoses.
Yeah, and I think speaking to that also is that as far as like trying to discern whether this is suicide or not, when I'm talking to individuals about suicidality, we talk about active and passive. And so I think that, the active ones are the ones that most definitely would or could be reported, but the ones that are considered passive is when somebody just, they have no regard for their safety or their health or their well-being. And so I've seen people, just about eat themselves to death or like freelancing. So going off and doing things that is dangerous. So I consider that kind of passive. So you've just lost that will or want to live. So you just disregard your own well-being.
And Beth knows, working with clients as well, that this is just the members that we have lost, and how many of us suffer from stress and anxiety and depression and physical ailments, mental health ailments. And we found, though, through our studies and the data collection, the top 5 known reasons why firefighters are taking their lives, fire and EMS. And number 1 is marital family relationships, followed by depression, addictions. Number 4 is medical/health, and that's increased most recently due to, unfortunately, firefighters being diagnosed with cancer. And family members saying that their loved ones have left notes saying they don't want to burden the families with this disease. And number 5 is PTSD, diagnosed PTSD. Now, are these all wrapped up together? Absolutely. In what we call cultural brainwashing. That's our term that we use in our workshops, is that it started early on in our fire academies. You were trained to be the best paramedic or firefighter you could be, which we all know falls under that: be strong, give help, don't ask for help, I can handle things on my own. And that translates into our home life as well. And if we can, hopefully break that. And our belief is, I don't want to change our culture. I'd be a firefighter 10 out of 10 times. We want to enhance it, and you enhance it through education.
It's nice.
So I guess the question right now is we look at all the things that bring us to here, family issues and financial issues and health issues. How do we make that more discussed? How do we get to that point where we're able to talk about that not only within our organization, but there's a lot of firefighters that I've personally spoken to that fear talking to their family about because of embarrassment or their ego or their image gets dropped down. How do we bring those conversations out in our firefighters?
Well, like I said, for me, it's education, because no matter where we go, we try to impress on people to get involved. Get involved with creating behavioral health program, peer support teams, CISM teams, become counselors, become, physical fitness, because all these are that component. And to let them know that it's all right to talk. I mean, my own personal PTS comes from my granddaughter at 22 months old, diagnosed with cancer and losing her right eye to retinoblastoma. And I can remember when they've taken her through the back room, my thought process was, hey, I'm supposed to do something here. Not only am I her grandfather, I'm a firefighter, I'm supposed to save that eye. And it's like, wow, where did that come from? I mean, who am I to stop that, unfortunately, happening? And if we can start bringing that education and awareness of how we act and that it's okay to talk about the issues that we are dealing with, and finding those qualified counselors and doctors that work with us to understand our thoughts and beliefs is key component. So developing resources for your organization is very key, as well as the training officers bringing and introducing behavioral health into the workplace.
Beth, do you have anything to add to that? I mean, bringing these conversations up can be difficult.
I was just going to add that, like it is about starting the training, starting the conversation early. And so there's a lot of question about, well, do you start with the higher ups? Do you start with the people just coming in? And the thing is that if you don't have people in the administration that support behavioral health issues and support the environment that allows and encourages people to talk, then you're going to have new people coming in that maybe they will talk, but they're going to learn quickly not to talk. And so, I think part of like this and everything that we all do out there talking is to get the higher ups willing to create that environment and support an environment where it does encourage individuals to talk and to share and support each other. But you do have to start with the people coming in. And so part of the academies, and I remember there's a lot of stuff to learn, but part of that has to be that it's okay to talk. It's okay to take care of yourself. It's okay to say when. And then to talk about the importance of taking care of your body and your physical aspects, your physical health, as well as that mental health, because as Shannon talked about, those are very much connected.
And Beth is spot on with that. You have to have buy-in from the top, and I'm sure she's seen it before. People calling her, I'll get a lieutenant will say, hey, my chief just wants, they want me to put together a suicide prevention workshop for our department. Well, guess what? That is really tough to do if you've never been involved in behavioral health and especially suicide prevention awareness, because this is not like, pulling a hose off an engine or something and doing fire attack. These are people's lives, and you don't know who you're speaking to that might be suffering some issues. And so that buy-in from the top is absolutely important.
And they have to be supportive. I've worked with several firefighters that were afraid to come and talk to me because they were worried that somehow it would get back to their chief. And they've also said that they were afraid to use their own EAP program, the Employee Assistance Program, because they were afraid that that was going to get reported back to their chief and that they would lose their job. And so there is a level of distrust that also has to be overcome as well.
Yeah, we found that confidentiality was the number one issue why fire and EMS, through our survey that we did. Confidentiality. Number 2 was job promotion, and 3 is that counselors just don't know our culture and our terminology and language. Yeah. And I know, I've known Beth for years, and I know even when we talk together, we still talk the talk. We talk the fire service talk and the language, so we're very comfortable in that. Well, if you go see a counselor, and God bless them, they're great people. Like I said, I got great friends, but if they don't know what we're talking about, and we're using, acronyms and things like that, it becomes very difficult for them to understand.
Mm-hmm.
Yeah.
Jeff, you make a great point. And as a person who this road and had some line of duty issues where I had to go see a therapist myself for some post-traumatic stress issues, and I wear that as a badge of honor. I don't wear that as a badge of shame. I mean, I stood up and got the help that I needed, and others to do the same thing. One of the things I can throw out there is to remind people that all therapists are different. The way that they experiences they have, and just one who doesn't understand where you're coming from doesn't mean you can't make with a different one that may be able to understand where you're coming from. For me, it took 4 before I found somebody who had experience in law enforcement, EMS, military, to understand where I was coming from, where they could understand and get down to the root of the problem. And I think that's one of the words of encouragement that we can give to the seeking help, is that first avenue you come to may not be the right one for you, and that just keep looking. Beth, I know you have a lot of experience in this coming from the fire side. And when we talk about getting help, I think one of the biggest things that I've come across from the individuals I talk to is the fear of going to see their therapist, not only because of confidentiality with the or working with an EAP, but because the therapist is stand. What words of advice could you give to some of the firefighters out there who are thinking about seeking help but are afraid because of the image they have of this therapist or that counselor?
Well, I think the hardest thing for anybody, no matter what you do or where you come from, is to actually ask for help. Especially as we've talked about for firefighters, because we're the helpers. See, I still consider myself a firefighter, but so once somebody's willing to make that call, I think that it's difficult to then, like, if that first one is not a fit, I think it's really difficult to then kind of overcome that hurdle again to go find another one. But I completely agree with what you said, and that is that if you are not a good fit, if you don't get a good feel, if that person doesn't seem like they're going to be able to work with you for whatever reason, then don't hesitate to find someone else. So I have people that drive a couple hours to see me in Washington State, and they drive because they know I'm a firefighter, and that's a draw for them. So, I've heard stories where they've gone to individuals where they felt like the therapist was only, like, they were more interested in the horror stories than in helping the individual, or they were unwilling to be flexible in scheduling. So it's things like, I think the firefighter schedule makes perfect sense to me. I think it's a great schedule. I really miss it, but most people don't work like that. Most people are 9 to 5 or 8 to 4. And so it's finding somebody that's willing to be flexible. And so I think that the individual seeking help, they need to understand what their needs are. And from the perspective of, they need somebody who's going to be flexible. They need somebody who they can connect with, and somebody who knows the environment, or at least they're willing to learn. So, if they can connect and have a good relationship with someone, then you can teach them about the environment. It's like, when you're in trouble, you don't really want to have to teach somebody how to relate to you, but if you make a personal connection, then it might be worthwhile to do that. But I think as a professional, it's more on me to understand where my client is coming from. And that's something that individuals seeking help need to understand, that their therapist should be willing to take the extra time to learn about them and to meet them where they are. But sometimes the person seeking help needs to kind of coax that or guide that along. But under no circumstances should they think that they need to stay with that person if they don't make a connection.
And Beth is right. I mean, as training officers, and one of the components of a behavioral health program is the ability to work with your EAP programs, invite them in for ride time, have them in for dinner, sit in through some training sessions to understand what it really is all about, and the talk and the relationships between the firefighters. And if they don't want to go to their EAPs because of what we mentioned about confidentiality or whatever it is then training officers and committees and organizations should go out into their communities and interview and build resources that way. Work with your chaplain programs. And that is key components, so that day when that firefighter comes in to you and says, hey, I need to talk and see someone, man, it's great to have all these resources. Well, we can do our EAP. They've been doing a lot of training with us, but we have our chaplain program out in the community, and we also have counselors in the community that are trained, and they're on our resource list. And, even if counselors or EAPs can build online videos so that families at home can see who they are and what they have to offer. We've had a wall between the fire service and EMS world and the counseling world for so long. And we need to break down that wall because, for the better of all our members. And I'm a firm believer, Chief, what do you think we're seeing more of nowadays? Structure fires or our personnel dealing with personal professional issues? And where's our training been? It's been on, yes, we have to have hose line advancement, live fires, but we really have to train our officers to know how to communicate and talk and learn how to listen to our people and then provide accurate resources.
I think we're back as training officers or instructors is actually bringing this in the very beginning of careers. We spent very little time. I mean, most firefighter 1 and 2 or EMT paramedicine, they all talk about a very short chapter on the health and well-being of police. And we spend very little time on it. We don't give them the outlet or the resources at that point. We talk about some verbiage, we go over definitions, we give them a test over it, and they're done, and it's never really brought up. We're getting halfway point. There's some things that we need to hit on. And the first to hit on is when do we need to seek that EE or that therapy or that outlet, whether it be mental health or physical, to get us through the hurdle. And then EAP is how they're not created equal and what we can do within our own organizations to either or utilize it effectively. So I guess we need to start with when do we actually need to seek help? I mean, when is enough enough? What are the personal warning signs? And what can we see as instructors or officers to help?
Well, we interviewed 500 fire and EMS that were struggling, and we found the top 5 warning signs were recklessness and impulsiveness, anger. And anger is a big issue that we need to really understand within ourselves. And I fight that personally as well. So, you have to understand, why am I acting that way? What caused me to have that type of response or those actions? Isolation is number 3. Number 4 is loss of confidence in skills and abilities. And number 5, sleep deprivation, the lack of a good sleep pattern. And I'm sure Beth and Shannon can tune in on that as well with some of their thoughts.
Mm-hmm. Yeah, so I think, what Jeff is saying is important to know, not only for yourself, but for other people, because what I found with the people I've been working with is, and the discussions I've had is that most often the things that Jeff is talking about are noticed by other people first. So before the individual notices those things in themselves, somebody else will say something. Like, you seem a bit more irritable than normal. You don't seem to have patience. You seem to lack confidence. So it's more likely that somebody else is going to observe that, and it's going to be somebody that's close to them that is going to be willing to speak up. So a lot of times it's a child or a spouse. And so I think one of the things that we need to do is like know that these are some of the things that can indicate that somebody is overstressed and not coping well, but to know that everybody gets overstressed and that we can do things like preventative things. And that's that, taking care of yourself physically, doing what Shannon does, do yoga, incorporate breathing, practice mindfulness. There's a lot that we can do to prevent. So it's like, it's not if you become overstressed, it's like when you become overstressed. And it doesn't matter who you are. You can only hold so much in your cup before it overflows or it becomes empty, whichever way you want to do that. And so it's like knowing that you have limits as everybody, and to do some things to start caring for yourself to begin with, and then to be willing to listen. Listen to yourself, listen to your body, listen to what other people say. If somebody says, hey, you seem like you're a little grumpy, what's going on? Then, be willing to hear that and then do kind of a self-assessment and decide, like, well, where am I at? What is the problem here? What's really getting to me? And then continue, and then seek help, or seek help before everything kind of blows up. We usually see people once things have blown up, and then they come see us. and they're worried they're going to lose their family, they're worried they're going to lose their job, they're concerned that they might lose their life. And we'd like to see people sooner than that.
Yeah, I'll go ahead and jump in here because this really sounds like it's in my wheelhouse. But certainly all the benefits that have been shared here about yoga in terms of helping with sleep and and giving people an opportunity to understand that there's a space between the stimulus and response, so they can exhibit more patience, more compassion. But I think one of the biggest things that, and this might be new to our discussion, is that because of the new neuroimaging technology that we have available to us, psychiatrists and neuroscientists are discovering that stress and trauma really does live in the body. And what happens to people who experience, like firefighters, who experience chronic stress or the accumulation of trauma, there is this lack of connection with one's body. So like Beth was pointing to, do a personal inventory, be able to observe your behavior and understand when you're getting angry or when you have less patience than normal. People who experience trauma, they lose connection to that. So what yoga practice does really well is it gets people back inside their body. So they can feel what they're feeling. They know when they're getting angry. They can take a moment before they react to something. They can choose a response. And in the Fireflex Yoga program, we actually use an assessment it's an interoceptive assessment. And we use it before our program and we use it after our program. And what interoception is it's this ability to be able to feel sensation inside the body that goes offline in an environment of chronic stress, and it comes back online when someone is practicing mindfulness practices, feeling sensation in their body, knowing what's going on inside their body. So I just wanted to add that to the discussion because I think it's an important component. Oftentimes, I know early on when I was speaking to fire chiefs about yoga, there's a stereotype about what yoga is. It's like, if I'm not flexible, if I can't touch my toes, I can't do yoga. Or if I'm not female, I can't do yoga. But really, yoga, especially in light of this new research, has a real opportunity to help firefighters and our first responders to deal with stress and trauma and all the implications of it, just by doing a practice that helps them get back inside their body. Did I say that clearly? It's a really important topic.
No, I absolutely. It's very clear and it's very accurate. They're able to read their bodies as well, and then find that the comfort when they go to yoga to reduce their stress or whatever issues they're going on. And Beth also hit an excellent point, is learning how to listen. I tell people in our workshops, if you could take anything away from it, is this section here, is learn how to listen, because we are so good at responding to calls and trying to solve the issues and help them through their problems or medical or whatever it is. But for that moment when they come into your office and say, hey, can we talk? And it's uncomfortable if you've never been trained, if they want to talk about a marital relationship issue, a financial, or their depression or addictions. And so many of us, we do all these role plays in our workshops, and it becomes very difficult for them to function. And I'll put up a house, a 2-story, with flames coming out, and I'll say, hey, your incident command, give me a blue card or something. And they can rip right through that, about sizing up and 360 and ventilating and water supply. But when we go in and we start saying, okay, here's a firefighter who had a gun to his head last night, how do you talk to him? And you can see they turn red and they're sweating. And so that learning how to listen is a key component within the behavioral health process within the fire service.
Yeah. And I'll say one more thing about, because Jeff brought this up earlier, about how some of the warning signs for firefighters who are at risk have to do with the number one warning sign or risk was family and marital problems. Is that right, Jeff? Did I repeat
Yes.
that correctly? Yeah. Okay, good. And so this comes back to being able to listen to one's body, to feel one's feelings. It's very, very difficult to relate to another person, your spouse, your children, if you're not willing to feel your own feelings. Furthermore, I know one of the issues that firefighters deal with quite a bit is compassion fatigue. And again, one of the things we learn in mindfulness practices is self-compassion, right? How to feel compassion for oneself in order to feel compassion for another person. And I think I want to say, feeling compassionate for our firefighters is that I understand, to me, without proactive practices, learning how to stay in one's body, learning how to regulate one's nervous system, learning how to feel one's feeling, I understand why a go-to response would be to isolate or to shut down because of what firefighters are exposed to day in and day out. So I think that this conversation and having practices every day that firefighters can go to and support themselves in their daily life is extremely important in terms of, kind of the umbrella here is looking at behavioral health, mental health, and suicide prevention.
One of the questions we had from Anthony listed in our text box talks about employee assistance programs. So can we briefly explain what an employee assistance program is? Acknowledge that not all organizations have an employee assistance program and what may or may not be covered in that program.
That's not something I
Beth,
can
you wanna-
respond to.
Employee assistance programs are sponsored or paid for by the employer, the city, or the department, depending on what the structure is for that department. And it involves some mental health individuals, legal. So it offers support for mental health, for legal issues, also for some health issues, for financial issues. So it's a place that you can go if you're struggling in any one of those areas. Then you can get referrals. So it basically is set up to be a referral network. And so most EAPs have their, depending on the state, there are specific RCWs or state laws that define how many sessions a person can have. So if they employ, and sometimes they don't, but if they actually employ mental health specialists, then they are confined to whatever that particular state says they can offer for sessions. So in Washington State, most often it would be average of 3 sessions. And so then when you seek somebody in the EAP for a behavioral health issue, they're usually short-term focused, solution-focused sessions. So you have a discrete problem, they may be able to help you. Often, though, when firefighters are seeking help through the EAP, they have a more complex problem. I mean, you've heard Jeff talk about the warning signs. It's like that pretty much covers all areas of an individual's life, their functioning. So I think what people really need to understand is that the other big part, or the biggest part of the EAP, is that they're referral systems. And so they will refer you out to somebody in the community. I work with, so when I worked for an EAP in my training, I actually provided some mental health solution-focused benefits for individuals that came to the EAP that I was working with. During extreme times, they were able to extend out the sessions. So like the max I could do was 6 sessions. Well, I was working with people who were transitioning from one job and looking to go into another job. So it was pretty simple to work in that avenue. When they come and they have more complex problems, like what most firefighters would be presenting, then we would want to see them get referred out to somebody in the community. So I also get a lot of referrals from a very, I think there are an EAP that is used across the country, and they will just call me and say, hey, we have this person, can you see them, or we think they might be a good fit, and their EAP benefit is so much money for 3 sessions or 4 sessions. And then I would have the option to see them beyond that as well, but that's a different kind of system. So I think that all EAPs are not created equal. There are some very good ones out there, but there are also some that just don't understand the fire service culture, and so they don't know how to make good referrals, or they will try and work with that individual, not understanding the complexity of what that firefighter is bringing.
And you have to understand that a high percentage, like I said, I've been across the United States and Canada, a high percentage of the EAPs are selected by a bidding process. And so what we teach the fire and EMS organizations is that if that's the case, then say, hey, we want to be involved in that. We want to interview those that are bidding and to see if they understand, if they have counselors that understand the fire and EMS. And if they don't, which unfortunately a high percentage don't, then it goes back to what I said before. Are you willing to allow us to train you to come in, do right time, and work with us, understand who we are, have dinner with us, get to meet our families? And that is one way that you can design it for the fire and EMS, is to say, all right, now we would like the resources. We want qualified counselors that you use as resources that understand why, because like I said, we're a little different. Not that it's bad, especially from Beth and I's perspective. We're just a little bit different, and you need to have counselors that understand us.
Mm-hmm. Agreed.
So we kind of brought this up earlier. I guess my question is going to become this. We're utilizing the EA referral program. Their firefighter is concerned that if they use the EAP that is to their employer for whatever reason, discuss in there, come back, they may have some questions. Beth, I don't know how you can answer this, or even Jeff. I mean, what is the level of confidentiality when you're dealing with an EAP program? Does it vary by program, or is it still hold that doctor-patient confidentiality privilege?
It should, and this also is dictated by the state and would be in the RCWs for that particular state. Well, I don't know if it's it may be RCW in Washington, but it's a state law. And so that defines how the EAP will work, and it should always be confidential. And so what would get reported back to the employer would be like so many people, so it could be like a monthly thing. So it's like so many people use the EAP, and then it might go far as to say a general category of what was seen, like, we had like 10 people and there might have been 3 marital issues and 4 emotional issues, and 3 physical complaints that were affecting them emotionally. So it would be like very general about that. I did hear in one of my presentations that there was one department that had an EAP program where if one of their members went there, it would get reported back to the department, and it could be grounds for dismissal because they could be considered unfit for duty. And I have never heard that before, but this one, they were absolutely adamant that that was how their system worked. And I think that that is exactly the fear in fire department members that keeps them away from the EAP. And it should not be, there should never be any reporting. And I think that that is a state law, so I don't know how that particular state would have gotten around it, or that department got around it.
Yeah, and there's just little things too. I mean, I've seen where a lot of the EAPs are near their headquarters, and people will be going into headquarters and say, hey, isn't it Jeff's truck over there at EAP? And how fast does that get around then? And so all those little things you have to watch out for. and Beth is right. It shouldn't happen. It could be just a monthly report. Hey, 7 people came and used our EAP, and that's it. But if it just takes one person to, unfortunately, there's a leak, and it might have happened in 1869, yet the legend lives in the fire service, and it just grows and grows. So it is an issue that we have to deal with, and that's why, as training instructors, to really build that relationship, get them out to the stations, get the families to know who they are is vital. And then, like I said, building resources. Now, on a weekly basis, I get 1 to 3 fire and EMS saying, Jeff, do you have someone in my area that I can go to outside our EAP? And I find them counselors. I do it for free because it's all about education. I commend them for calling. And so if anyone wants, I have 11 questions that I vet the counselors with. And if anyone wants those questions, just email me. I put my email address into the comments there. If anyone wants those 11 questions so that you can vet resources for your department, then please just email and I'll send them to you.
So I think the big takeaway from employee systems is to get with your employer, realize what they offer, and what any contingencies may be with those. There are some employers that I've read about that sign a release that anything's discussed or a report can come back from the counselor, just like any other HIPAA form. You are afraid or have concerns about that information getting back. You don't necessarily have to use the EAP to get the help you want. We don't want to discourage them from not getting help because they're afraid the EAP program or something might get back to them. Feel free to come and help locate a therapist or a counselor in your area. I'm sure Dr. Murphy may be able to assist that too. I do want to kind of get to this question. Will, a very interesting question. He says, do any of our panelists envision emotional intelligence tests becoming part of the hiring process for firefighters? In our area that we don't do that yet. There are some agencies in the outlying kind of corners that are starting to do that. The question is exactly what are they going to look for? Are they looking for somebody's ability to have a little bit more compassion, will stand up and speak? I don't know where you guys kind of stand on that, but know that we're transitioning from that stereotypical big, muscular, meathead that runs in and puts the fire out to these guys who are intelligent, think through things a little bit more, and have background that'll facilitate them running calls better. But I haven't seen anything where we've actually interaction of firefighters with other people yet.
So I do psychological testing, and so I think that this is actually a really interesting question. And I know that I've been approached by a lot of different departments about the benefits of psychological testing. So I think that in general, psychological testing is a tool as part of the pre-hiring evaluation of the individual. I think one of the issues that really comes up for the fire department is that a lot of the testing and the comparisons that they make, or the norm reference. So when people test, they're being compared to a reference sample. And so a lot of times it's what the police do, because psychology is something new for the fire service. And so some of the calls I get is from fire departments that say, we're not happy with what the police department does and what they say that we should be hiring. And so a big part of psychological testing is deciding what it is that you want. What are the qualities that you want? So, there's been the focus on the physical aspect. So you have to be fit enough and strong enough to do certain aspects of the job. And so we just kind of, when we started doing psychological testing, then we were like, okay, we'll do what the police do. Well, that doesn't work because they have very specific criteria. So there are also the emotional criteria. So yes, you want people who can be compassionate, and you can test for some of those traits. You want somebody who can work well with others. You want that team player. So there are traits that you want. And so when fire departments are testing from the psychological aspect, they should, find a psychologist that's willing to alter their test battery to fit the criteria that the fire department wants to identify. And so that hasn't been the case. It's been kind of like, okay, well, this psychologist offers this psychological testing profile, so I guess we have to go with that. It doesn't have to be that way. The fire department can be in the driver's seat and say, we want these criteria, and we want your tests to identify the best fit for this criteria. And the tests that are out there can do that. But it is one tool and only one tool. It should not be the only thing that is that a hiring decision or a promotional decision is based on, because sometimes, it can be misinterpreted.
Yeah. Did you want to say something about that, Jeff?
No, I think Beth hit the nail right on the head absolutely accurately.
I just want to say, yeah, I totally agree too. I want to say one thing about it also is that I definitely see the value of being an emotionally competent person in the fire service and just in life in general. Once again, being able to know what we feel and where we feel it is a really important part of just having agency in our lives. And also from a body-based perspective, every emotion has a physiological component. So you can actually work with your emotions through your body, through yoga postures, through yoga practice. Again, just increasing our EQ, our emotional competency.
I think all of those are extremely valid points. I think we're going to see that in progression of the fire service. I think it's still, like most things, the fire service is going to take us a little longer to get there than we'd like to see it happen. And I think you make a great point about having to try to kind of fit this for the fire service. We can't use the ones that the military uses. We can't use the ones the police department uses, because we have a completely different set of policies and protocols that we go by compared to everybody else. The unfortunate part is, you're literally talking about this all day, but we're getting to the point where we are pose one question to the group, and then we're going to kind of finish up, let everybody get their contact information out there so we have some resources available for people. This question comes in from Tobias, and he says, our department is tracking traumatic incidents as workers' comp instead of and separate EAP. Do we see other organizations towards that? I can say ours does not point, but we are working on we're trying to develop a means for that to happen with the assistance of Jeff, figure out how that would fall comp versus employee assistance. Anybody want to kind of jump in on that?
I want to say, when you talk about traumatic incidents, I've spoken with Chief Halstead up in Sandy Hook and Chief Garcia at Aurora Theater and Chief Bullock up at Umpqua Valley and the mass shootings. And, we didn't see that when I got on the job many moons ago. And, we have to start understanding, through my conversations with these fire chiefs, is that anniversaries are a real bad time. And so if you take an incident within your organization, and it's a very traumatic one, whether it be civilian death or line of duty death or injury, start marking those on your calendars, and maybe at a 6-month or a year, every year, so that you can visit that, and just to make sure your people are okay, because anniversary times are very key components around traumatic incidents. So, there's so much more we can go into, but I know that we're limited, but that's my 2 cents real quick on that.
Yeah, and I don't have any knowledge or experience with that, so I wouldn't be able to really speak on it.
Yeah, I'm in the same boat as Beth.
So Shannon, one last question for you. It's more towards your end of things. We had a question posed about some of the exercises you could do with yoga, or some of these you could do. It's a little further up on the question list. I think I throw over the top of it. Yeah, I'd love to know more about yoga assessments. Can you kind of fill us in on those?
Sure. So one of the first assessments that I came across when I started working with firefighters, and it's actually a really popular and highly normed assessment in the world of professional athletes, is something called the functional movement screen. and it's designed to get just a quick and efficient baseline on how firefighters and athletes are moving through fundamental movement patterns, things like, standing to sitting, squatting, lunging, crawling, running, climbing. So it made a lot of sense when you think about what do firefighters do every day, especially lifting and all the medical calls that they do, that this would be a screen. Again, coming back to the EQ question, we're just talking about getting baselines. Where are we starting from? And then we also use something called an interoceptive assessment. And the reason why we use interoception is just one's ability to feel and identify sensation in the body. But it's also been linked to peak performance. And thinking about firefighters having to perform at the highest levels, both physically and psychologically, often and repeatedly, it's important for them to have high interoceptive capability. But the problem is that that part of the brain goes offline after one has been exposed to stress and trauma over the time. So again, we use interoceptive awareness and we use functional movement screen. We get both the physical and psychological baseline for our firefighters. We use those to customize the yoga program. And then at the end, we have those firefighters go through the same 2 assessments. And then we're giving departments an opportunity to just have more information, to manage risk, to maybe provide more support for people who, are not scoring very high on our stress assessments, and that's how the program works. And so far, in all of the departments that we have been in, they are all signing up for more programs, and more fire chiefs are giving us a call. So I'm very excited to be able to offer this service.
So I want to give the panelists one last opportunity to any thoughts that you might have. I know one of the ones that I've always said, if he has any issues, I don't care if you're from Calabasas or right here in my home state, and if you contact me, reach out to somebody. Plain and simple, if you're having stressful issues, you need somebody to talk to, don't be ashamed. It's not that we need to hide under the covers anymore. We are all human. We all have emotions. We need to be able to cope with those. And if we don't, then we end up another number on the chalkboard. And I'd hate for those numbers to continue to grow.
Yeah.
Yeah, just to summarize, just to finalize, I believe it's incumbent for all organizations, and it unfortunately falls into the training officers, to help create that behavioral health program. And there's so many points to it. One of them I really firmly believe in is peer support teams. It's that first line of help for your members within your organization. And there's 3 good ones out there, and I don't get anything for it. It's just I've sat through their programs. The Illinois Firefighter Peer Support, then you have the IFF, and then Joanne Rupert out of Colorado does a lot of peer support training. And it's nice to have that help that you can go to on a day that you're not feeling well, and you can go right to your brothers and sisters and say, hey, can we talk? And they're trained to help listen and direct you to resources. So that's a key component of a behavioral health program. So, and I commend everyone for please speak when you're having these issues. There are so many people, like people on this panel here today, that are here for you. And it's been an honor, Chief, to be here with Beth and Shannon discussing these issues, because unfortunately they're not going away any too soon.
Beth, any final words?
Okay.
Oh, sorry, Shannon, go ahead.
Okay, I'll say, thank you again for having me here on the panel, and to just know that, there's this phenomena in cultures and systems called emergence, when small groups of people start to impact change on a global scale, and it happens through, just like what Jeff was saying, discussions, individuals making a determination to seek out help when they need it, networks of people coming together and talking. And we can't really predict when emergence happens, but what I can say from my small time doing Fireflex yoga in the fire service is that when I started, first of all, just being able to bring yoga into the fire departments is an evidence of a changing culture, not something that my father would have been open to when he was a firefighter. And then, right, so that was pretty amazing. And then 3 years ago, all anybody wanted to talk to me about was how could yoga help physical fitness. How can we get a handle on our injuries related to strains and sprains? And the last couple of weeks, I've been getting more calls than ever wondering how can yoga support and mitigate the psychological impact of firefighting. So really change is happening, and all of us keeping up the good work is critical to having this emerge in our culture.
Looks like we Dr. Murphy. If we could have one final thought, I think it would be to look out for yourselves and look out for each other. It's really what I want to. The military is this buddy to program to check in on your people and make sure everybody's doing okay. We need to remember that this is an everyday thing. We have bad calls all the time. We have family issues all the time. Make sure you're monitoring your people. Instruct officers out there. You are truly the first line of inception for your firefighters. You really are. Look out for their physical and mental health. I want to thank everybody for joining us today. I want to thank who attended. This is an issue that we really need to realize and get out there to our departments and make sure that it is that we discuss and not something we the rug anymore. At this point, we're going to stop recording again. Thank you for joining us, and remember the International Society of Fire Service Instructor Conference is coming up. It's only 7 months away. It seems like it's far away, but it's really not. Being Fort Collins, Colorado this year. The contact information for Jeff Dill and Shannon McQuaid in the section, feel free to visit their website. I'm also including Murphy's email address. She kind of slipped out on us. I hope she doesn't get too upset at me. And also, you can always visit us at www.isfsi.org. Again, thanks a bunch for joining us, and have a great day. All the folks that decided to join us today, keep safe and look.
Thank you. Thank you very much. Bye, Jeff.
Bye-bye, Shannon.
Bye-bye.